I'd like to take the time to demonstrate the procedures differences between shockwave therapy and prolotherapy. Prolotherapy, of course, uses a saline solution or a glucose solution in a needle like this to inject that solution into the enthesiopathy of the ligament, the area where it inserts into the bone. That might be into different locations and possibly into the anterior cruciate as well. Now, the obvious drawback to the prolotherapy is the fact that it does use a needle. The needle end of the blade is shaped like a cutting surface, like a sword, and if you've already got a torn and damaged ligament and you bring this needle in there, you run the risk of causing a little bit more damage to that structure. Also, the glucose and the saline solution themselves are not a natural inflammation chemical that the body uses to promote healing and repair or to signal that an injury has in fact occurred. So you're putting a foreign substance in there, and you run the risk of infection or allergic reaction with it as well. Also, in order to get the broad area of the insertion of the ligament, you have to do multiple punctures through the skin into that area. And whether it be around here or here, it would need dozens of applications to get that done. In the case of the shockwave machine, the high pressure wave is able to penetrate through the skin and reach the enthesiopathy in this region, and it will cause a natural inflammation to occur in that area. Also, shockwave is known to promote angiogenesis, so new blood vessel formation will occur in this area, and of course the greater the blood supply, the faster and more complete the healing is, and the more natural that is. Now, obviously, because the shockwave is not a needle and it just penetrates through the skin with a pressure wave, we can fan over a large area of the enthesiopathy and get a very complete exposure to that beam and a complete reaction in terms of inflammation and angiogenesis in that area. Another problem faced by the patient with the damaged ligament structure is that the joint complex, because it is unstable, requires the surrounding musculature to help stabilize that. And these muscles in this area tend to become tighter and cramped up, and they don't function as well as they do originally, and they produce a lot of pain around the joint as well. The added advantage of the shockwave is that we can change the transmitter out, and we can use a different transmitter to smooth out all the muscles in here, treat the knotted fibers, shred those down, allow the body to put in new fiber material in that area, and it significantly reduces the muscular pain associated with a joint injury as well.